us registered to be able to receive these emails. But we're really glad to see you here. And as you can see, they're filling up really quickly. My name is Emily Nichols. I'm the Indiana Regional Program Manager, and I'm going to be facilitating today's call. And we're talking... And we're talking all about just tech and mental health today. So we have our friends from Hopelab, and they're a social innovation lab. They kind of create behavior change tech to help teens and young adults live happier, healthier lives, which I really love. And with the pandemic going on, we thought about having a discussion on technology and mental health would be really, really timely. So we'll start off with some fun activities together. We'll do another poll like we did last week just to help foster community a little bit more. Then we'll get into a discussion with our special guests from Hope Lab, the psychologist, Dr. Danielle Ramo and Dr. Nathaan Demers. Like I said, we're gonna talk about mental health and technology, but from what we've seen from our club members, I know a lot of you have thought about maybe pursuing a career in mental health as well. So we're going to get their perspective about how they ventured into this journey as well. We'll also talk about a new tech that they're using, an app called Nod, which helps prevent loneliness, which is something really important right now. So are we ready to get started? Thumbs up. Awesome. So again, rule setting, just make sure not to unmute unless you have a question, just to be respectful. We do have Bring Change to Mind staff monitoring the chat, so should you have any questions or technical issues, you can do that there. We are going to be recording the call, and we will be doing a gift card giveaway that we were talking about for signups that we'll be doing at the end of the call, so stick around till then, which we're so grateful to Hope Lab and Grit for graciously donating that for everybody. So let's get started with some fun activities. I gotta take my blanket off because I'm cold. I'm gonna share my screen with you all and give you a new activity. You know, the past couple weeks we've been doing, let me pull this up. Some fun clapping activities, but this time we are going to do some fun stretching activities. So you can stand up if you want, you can stay in your chair. The first one is just the cough into your elbow, dabbing stretch. You don't have to really cough, but it's just kind of like, like that, okay? So we're gonna stay on mute just to avoid any echoing, but we're gonna do it a couple of times. So 3, 2, 1, we'll just, oh yeah, just dab it out. You can do it the other side. Okay, we're stretched out that way. This other one, like you said, is sharing the stockpiled TP. So act like you have a roll of toilet paper and we're stretching to the side and stretching to the other side, sharing the wealth right now. And then this one is my favorite. We're gonna stretch up to the sky and say, this will all be over soon. Woo, let's do it again. Yes. Oh, that feels good. Feels so good to stretch. All right. Thanks for humoring us and going through that with us. I think we all feel way better now after doing that. So let's go ahead and get into some fun activities like we talked about. We're going to start off with an interactive poll. Okay, so I'm going to turn it over to Brenna, and she's going to give us some instructions on how to do this. So Brenna, take it away.
Hi, everybody. I'm Brenna, and I work out of our San Francisco office. Well, currently sheltered in place at my mother's house. But I work with our East Bay schools and North Bay schools in California, as well as our national schools kind of scattered across the United States. So I'm going to take us through a fun interactive poll just so we can get to know a little bit more about who is on the call. So I just sent something in the chat you all will see, and if you see that link, if possible, if you could type that bit.ly/BC2M poll into another device besides the one that you're using for the Zoom, maybe you have a phone nearby or another tablet, that would be fantastic. And so that is where you're going to be answering all of the poll questions, and I will be moving it forward, so no need to press submit or anything like that. So I'll let you guys type that in. Maybe just give me a thumbs up once you have that up. Okay, I'll give you a few more seconds to type that in, and then I will share my screen so we can start to see all of the different results. Okay, more thumbs up. You guys got that? Okay, sweet. So I'll go ahead and share now. You guys can see that? Great, so you can see these little green dots of where you guys are calling in from across the US. We have like a lot of different states represented today. Lots of California, that makes sense. Lots of Arizona, I see. And then we kind of have to skip over to the other side of the country. For the rest of you, got lots of Indiana, Ohio. I see a Pennsylvania. New York, this is testing my geography skills, I guess. New Jersey, New York, Vermont, Georgia, Colorado, oh my goodness, Michigan. It's really exciting to see how scattered we are across the US. And hopefully this is another reminder that, being part of this student movement of Bring Change to Mind, it's not just the actions you're taking at your school, but, we do have this impact across the United States. So welcome to you all to this call. So I'm gonna go ahead and click over to the next question. So it should appear on your phone or device. So since today's call is about technology, I just want to get a feel for what type of technology has been helpful for you during shelter in place. There's obviously a lot, and I know for one, personally, I feel very grateful that we have all this technology and the internet while we are stuck at home. Really does help with that feeling of connection with others. So I see a lot of people have been doing Zoom or other video chatting software. That makes a lot of sense. Social media, Instagram, Snapchat, Facebook, all of that also seems to be really big. I know that can be positive, but get a lot of positive quotes and ideas for things to do on there, but also can be a little negative. I'm sure that will come up during our call later. And also streaming services. Thank goodness for those. I have started so many new shows this year, so that's fantastic. And we see some wellness apps, video games, fantastic. So it's great to see the diverse types of technology that we're all using right now. So moving on to the next one. Now kind of changing gears here to talk about mental health careers. So if that's something you've ever considered going into, what are some of the careers that you might have been thinking about or brainstorming about before? So you see therapists, makes sense, psychologist, psychiatrist, nonprofit, working in school. All of you, I'm sure, are very connected to your school counselors. I know a lot of our school counselors are club advisors for our clubs. We're very, very grateful to all of them. Medical fields, a family therapist, advocacy, wonderful. So maybe even taking a more kind of political policy route. I think that's really huge too. Forensic psychology, ooh, that's very fun. Lots of advocacy, I really love to see that. Grant making, God bless you, whoever said that. That is a hard work. You can email us if you want. Just kidding. But yeah, activism. This is wonderful. I love seeing all the diverse types of careers that you all have been thinking about. Neuroscientist, wonderful. Great. So I'm going to go on to the next one now, to our last one. So right now, obviously with social distancing, we like to say physical distancing, a lot of us are really relying upon friendships right now. So kind of looking back and just thinking about how we are connected to others, because the social connection is so, so critical. What are some ways that you have made friends or connections in your past? I see camp, school, hobbies, sports. I know some of my best friends in high school came from my softball days. So dance, activities, beliefs, classes, journalism. So a lot of these like hobbies and things where you find other people with similar passions. I see clubs in there. Hopefully you guys have made some really wonderful and special connections with your Bring Change to Mind club members through the years. Leadership, oh, this is wonderful. It's really nice as we're all trapped in our houses right now, or feel trapped in our houses right now, to be reminded of all the wonderful ways we can continue to make these connections once we're all kind of back into our normal groove of things and can feel that sense of connection and passion in these particular activities. So wonderful. Thanks everybody. That's it for the poll. I'm gonna stop sharing my screen. And I will turn it back over to Emily.
Awesome. Thanks, Brenna. That was so cool. There were so many great suggestions you have on there for careers and mental health. So I'm excited to talk about that a little bit more. So, okay, we are going to get into our discussion. As before, like we've always been doing, we are going to be doing a question and answer session with our special guests after our brief conversations with them. So as we're talking, feel free to type any questions you have around mental health and technology, or even careers and mental health, into the chat. We always get so many wonderful questions, gang, and I'm afraid we aren't able to usually get around to all of them because you guys have so many great questions. But you may have saw in our stories yesterday, we are reposting some of the questions that weren't answered from some of our guests later on, because they've all been willing to answer them later on for you. So if we aren't able to get to you, if we kind of skip around, don't worry, we're going to try to make sure everyone is at least acknowledged in some way. Okay, so feel free, like I said, type your questions in the chat as we go. So let's get into our conversation. First, I'm going to introduce you all to Dr. Danielle Ramo. She is the Senior Director of Research at Hopelab, and she helps oversee the design and implementation of research efforts all across their projects. So she regularly speaks to teens, parents, and the media about substance abuse and mental health among young people in the digital age. So she is the right person to be talking about mental health and technology. So Dr. Ramo, thank you so much for joining us.
It is such a great pleasure to be here. Hello, everyone. I already feel like I've learned so much on this call. I'm going to go downstairs and dab arm cough with my kids after this.
That's a great way to remind her to cough into your sleeve. I love it. I love it. So, well, let's get into this conversation. So like we talked about, we're talking about mental health and technology. And right now during this pandemic, I would think everyone would agree we're using technology even more to connect with people right now. But also I feel like technology can be a little draining at the same time. So what suggestions would you have for our students for finding the right balance right now?
Yeah, thanks, Emily. That is a question I'm getting asked a lot. And frankly, the challenge around balancing technology to try to take advantages of some of the ways it can be helpful in our lives, but not allow us to get consumed by some of the negative factors, was something I thought a lot about before COVID-19. Now, under the current circumstances, that question is even more acute for every one of us. So, you know, I think what I recommend is having a frame that social media and technology are affording us some amazing opportunities right now. Right? As we've highlighted, we all would not be connecting right now if it weren't for technology, if it weren't for Zoom, if it weren't for the internet. There are a lot of really promising and loving and hopeful messages and ways that people are connecting using social media and technologies like Zoom. So on the one hand, that might lead us to think we ought to be more connected or more involved with technology than we may have been even just a month ago. That being said, we have to be more aware of how much technology we're consuming, and that means how much of our day is spent on technology, and be really, really active and overt about taking breaks. And then also being aware of some of the negative impacts that technology may have on us. And I can talk a little bit more about that in a few minutes if folks would like, but we know that there are some negative aspects of social media, particularly for those who are experiencing or more vulnerable to things like depression and anxiety. We may be more likely to tell ourselves that have negative thoughts or tell ourselves bad things when we have a negative interaction on social media. So that might be more acute right now and more likely to happen. So we may need to limit it in some ways too.
Yeah, I think doing almost a social media audit, you know, going through whoever you're following and maybe unfollowing or muting people at the moment if maybe they're putting negativity into your thoughts, or you find yourself even comparing yourself, even if it's someone that you really, you know, enjoy following, but maybe it's not helping your mindset.
I'd say people is one area for that. So kind of do a little inventory on whether there are people with positive messages and energy for you on social media and on technology, and also channels. So for some of us, it's really helpful and soothing to consume news right now, but it can also be really overwhelming. So the other piece is being aware of what channels you're following. Maybe you want to unfollow certain channels that are giving so much information that it's frankly too much, or limiting the time of day when you are either on social media, or allow yourself to go to certain news websites or things like that, so that it's not so overwhelming. So it's sort of the person level and the channel level, or the outlet level.
Yeah. And I like how you said taking a break earlier. It could be as simple as turning off your phone or turning off your notifications, putting it in another room, just so it's not so tempting to automatically open it and start scrolling.
Agreed. And if folks on the call have other strategies that have been helpful, please feel free to put them in the chat. I'd love to hear what's working for you around limiting social media or digital technology intake right now.
Awesome. You know, like I mentioned, so many of our students are interested, and from that poll definitely could see that they're interested in pursuing a career in mental health. And I feel like there's so many different paths and avenues they could go down. What was your path like, and what suggestions or advice would you give to these guys listening in?
Sure. So there are things about my path that I think are maybe helpful and that I might recommend would be good for people to consider, and other strategies that might be good for people to know so that they don't follow the same thing, because we can't always know what's going to be best for us at the outset, right? So I am a clinical psychologist by training, which means that I have a PhD in clinical psychology. I was motivated to go into this field when I was in high school. I had some experiences that made me realize being a teenager is really hard, not only for myself, but I had a few friends who were really affected by substance use and mental health issues, and I felt powerless as a friend. And I really didn't know how to help them, even when there was a very, very acute situation where I thought, I wish there was something I could do in this moment to support this friend, and I had no resources. So I was really frustrated by that powerlessness. And unfortunately, that continued in college. Had a few friends who really had issues, and one person who overdosed and died right after college. And it affected me deeply. Not only because I wanted to be able to help and wanted to be able to think about how perhaps this person could have had a life beyond age 22, but also because it struck me that solutions and support for teens really should be different than that for adults. And a lot of the solutions that my friends were told about, things like AA meetings or certain kinds of treatment, felt like they were more solutions for adults. And it was like, oh, just go jump into that thing, or go find out about that thing. And it really wasn't something I thought would have been resonate with my friends or me. So I got into this field because I wanted to figure out how to help make treatment more accessible and meaningful, and something that teens would actually feel comfortable going to. So in my mind, clinical psychology was a good way to support both my individual interest in helping people and a way to kind of make an impact more broadly. So I didn't major in psychology as an undergrad. You'd think that would have been a nice step, but no, I was doing a couple other things, and majored in economics and urban studies, which was interesting and rewarding at the time. But I realized after college that I wanted to get serious and get a PhD in clinical psychology. And boy, is that seriousness no joke. So I went back and got an the equivalent of an undergraduate major in psychology at Columbia, where I was near where I was living in New York City at the time. And then deeply got into being involved in some research studies as a research assistant. and applied to grad school and jumped in San Diego, where I went to grad school. And I studied adolescent mental health, adolescent substance use, and helped to understand and develop treatments that would be supportive and impactful for young people. The last thing I'll mention about my path is that I came to UC San Francisco for my internship, which is the last year of training in clinical psychology, where we do full-time clinical work. You're deeply in my case, teens, families, adults. And I wanted to research helping young people quit smoking cigarettes and reduce heavy drinking. And at the time, the biggest social media platform was Facebook. It still is, but it was just Facebook then. And it occurred to me that maybe going through social media would be a way to help teens and young adults engage more in treatments that we knew would work, but that not a lot of people were engaging in. So I developed a quit smoking intervention for Facebook, and that opened up a whole world of evaluation and testing of using social media to support quitting smoking, reducing heavy drinking, and supporting mental health. So I kind of had this lens starting about 10 years ago of using technology for good. And that led me to find what ended up being my dream job a year and a half ago at Hopelab, which makes technology-based solutions to support adolescent and young adult health. So now I get to use my clinical skills as well as my research skills to help make behavior change tech with young people that young people actually want to use and that will change their lives.
Wow. That's really great. And you know what? There's a couple of things I want to unpack there, just you talking about, I feel like a lot of people maybe go into the mental health world because maybe they have some type of personal experience, either themselves or a loved one or a friend, where they saw go through some type of mental health issue and they felt like they couldn't help them. But also I think something really important to note, and I think all of you would probably agree, solutions are different for teens as they are for adults. And that's where you obviously are using technology to reach these young people and meeting them where they are to be able to get on those solutions.
One of the things, there's a whole world of sort of digital mental health out there. There are a lot of companies that are making apps that are trying to support people's mental health all across the age spectra. But the cool thing about working in the health of young people is that the technology part is pretty already there. It's already, I love this idea that social media can be something really positive and that can have really hopeful connections and allow for people to express themselves in whole different ways than they could before social media was around. And young people are making that happen. It's a lot harder to try to support health and mental health of older people using tools like social media, but the connections are already there among adolescents and young adults. So it's just a matter of getting some of the specific tools that we know can be helpful through those channels and doing it directly with young people so that the tools are actually cool and fun and
right. Right. Well, let's talk about some of those tools a little bit more. Thank you for that conversation, Danielle. We're going to come back to you in just a few moments for some questions from our students. But I want to turn it over to our other special guest, Dr. Nathaan Demers. Let me tell you a little bit about him. He's the VP and Director of Clinical Programs with Grit Digital Health. And the majority of his time is spent working with improving student behavioral health and well-being. And what I really love about his passion is he's passionate about people, and it led him to his career as a clinical psychologist, kind of like what we were talking with Danielle. It started with having a connection to someone with a mental health condition. And he'll share with you his career's had quite a few twists and turns as well. And he's an active traveler and athlete, and these aspects of his life has really inspired him to think beyond the traditional realms of mental health care. So Dr. Nathaan Demers, thank you so much for being here.
Yeah, thanks for having me. Really excited to be here with you all.
Awesome. Well, I want to talk a little bit about the app you all have developed called Nod, which we mentioned earlier is helping to prevent loneliness within teens. But I want to hear a little bit more about your journey and your mental health career.
Yeah, I'm happy to. And I think like Danielle's, there's a number of twists and turns, and as you alluded to. And I think that's actually one of the things that I've been really excited about talking with young people nowadays, is that field of psychology is very different nowadays than when I started, than when Danielle started, than when everyone else started, and that there's so many unique opportunities. So you'll hear that in my journey. But I grew up in a multicultural household, and half my family's from India. So going back and forth, I just became fascinated with cultures. And from there, I was lucky enough to play soccer abroad for a handful of years as a late teens, like 17, 18-year-old. And again, just threw me into worlds and countries that I didn't speak the language, and I had to fit in and try and, make friends with people that I might take their spot on the field. And there's a lot of psychology in that mix. So I always knew psychology was something I was interested in. And my first day of college was Psych 101. And the professor walked in and said, "Welcome to Psych 101, the course that changed my life." And that couldn't be more true for myself. And that professor is actually a really close friend. She actually married my partner and I. She comes and visits every year. So how that journey started was I had a great experience in Psych 101, and I just started doing internships through the summer while I was in college. So working with youth largely that had behavioral health challenges, psychiatric units. And I also had a soccer coach who did a lot of work with immigrant youth, which really, again, just inspired me to say, we can do a lot better than just treating mental illness. We can actually help people become resilient and develop further skills. So after I graduated, I did one quick pause. I was a soccer player in college, and I had a really big injury and missed my senior year, which was incredibly difficult, but I was actually afforded the opportunity to join the coaching staff. And what that did was open up my mind I had always been a player. I was on the field doing my part, and all of a sudden I was thinking about, wait, how do you run a nationally competitive soccer team? How do you budget? How does the system work? So I brought that experience into my clinical training. So I got my doctorate in clinical psychology. I got a PsyD. And if folks are interested in talking about the difference between PsyD, PhD, and all the different degrees, I'm more than happy to do so. But I worked as a clinician in community mental health. I did inpatient burn and neuro ICUs. And then I really fell in love with college counseling. And I did my dissertation on the construct of maturity. But while I was doing all these experiences, I was really focusing, in addition to the clinical work, just about our larger systems of care. So why are people coming to see us? Who pays for this? Why would someone see us instead of someone else? And a lot of questions about insurance. As I'm sure you all know, it is really difficult in this country. So after being a clinician for a number of years, I joined a nonprofit that was implementing large-scale systemic interventions in the Western 15 states and American territories in the Pacific. And quite frankly, just very quickly, I fell in love with that work. As much as I loved working with a student or an individual one-on-one in therapy, being hired to help the state of Alaska figure out how to bolster their systems of care got me really, really excited. So I did that for a handful of years, and long story short, working in the grant world has its benefits, but also has its challenges. And one thing that was amazing is you become a very good generalist, because whatever is being funded at the time tends to be the work that you're doing, which was awesome for an early career. But I was lucky enough 4 years ago to meet the team at Grit Digital Health that largely had that same mission of reaching underserved populations, but doing through technology. And ironically, I'm not that much of a tech guy, but being all about reach and impact and being able to do so scalably and quickly is really what attracted me to it. So here we are now, and now we're here talking, and that's really what Danielle and I have in common as well, is that real passion for technology, scalable prevention, and not just treating mental illness, but promoting mental health.
Exactly. Oh, I love that. And quite a few twists and turns for your journey as well, which I think is really important to note. Well, can you tell us a little bit about this app you guys have developed, just briefly, Nod, and how you're using it to prevent loneliness?
Yeah, I'm happy to. So I'll do a quick overview of the background, and Danielle, please note that you're welcome to jump in and add. And then if it's okay with you, I'll actually do like a minute or two screen share just to kind of show you what it's all about, and we can go from there.
Great.
But Hopelab and Grit basically converged on this idea of working on addressing the issue of loneliness. So Hopelab actually led a systems mapping exercise where they looked at all the inputs that are both positively and negatively impacting the overall health and specifically mental health of youth. And they very quickly, well, it wasn't quick, it took a long time, but noticed that loneliness was really a linchpin to a lot of mental health and well-being in general. And the other thing is loneliness cuts across SES, gender, ethnicity, geography, all of those demographics. So by working on that topic, it could really have a large impact on this whole system. So I want to pause there and see if Danielle has anything to add before I go too much further on that side.
Only to say that this process started 2 years ago. So this was pre-COVID-19. This was we are socially or physically distanced. Loneliness was a particularly big problem well before COVID. And it was a big problem, particularly among younger people in the United States. Loneliness is often thought of as an affliction of the elderly, but in fact, there are higher rates of loneliness reported by young adults than there are the oldest generation.
Yeah, really fascinating. Everything I'll just share in terms of health outcomes, we also know, and it's really come into the limelight. I'm interested in your all's knowledge of this, but loneliness has been essentially, the Surgeon General said that it's the equivalent of smoking about a pack of cigarettes on our overall health. It can increase anxiety, depression. It can increase our risk for cardiovascular disease, substance use, as well as contribute to suicidal thoughts and ideation. So it's a really important factor. And in the college landscape, it's something that a lot of campuses have been working on. And what we've heard is a lot of students come to college and they're experiencing a little bit of the environment as being threatening and having difficulty connecting, which can lead to a cycle which actually exacerbates itself where one experiences loneliness and that further prevents them from making connections. So I'll quickly jump in. I'm going to try and share my screen and hang tight. This is the first time I've ever done a screen share from my phone because this is an app. So you're going to have to give me some slack as the old guy here. So give me 1 second. How is that coming across for you all?
It looks great.
Okay, awesome. And I'll get my email out of the way. But at a really high level, once you log in, and just to let you know, this is free, open, and accessible. And one thing I forgot to mention is that we have originally developed that to help students connect with people in the real world. And we conducted a randomized controlled trial, largely thanks to Danielle, and got the proof that indeed we are helping buffer the most at risk for loneliness and depression. But of course, with an app that was encouraging folks to get out into the real world and make social connections, that was, oh, that's my son, didn't mean to do that, but he is really cute. He'll probably run in at some point because I normally end at 5:30, so we'll see. But with that, we obviously didn't want to continue encouraging people to go into the real world and form those relationships. So very quickly, our team in Hopelab pivoted to adapt all of the content in the platform to make sure that it is COVID friendly. So at a really quick high level, there's 3 main components. When you come into the app, you first rate what you'd like to work on in respects to social relationships. And again, I'm going to be jumping around and going really quickly. But the next part of the app, and I'm not going to be able to pull it up just because I can't talk and scroll too much at the same time, but are a lot of testimonials from students that really say, you know, forming friendships takes time and effort. One thing we heard from students is that there's this myth that making friends should just be really easy and effortless. And a fascinating thing that we heard is that we all know, you know, we have to put time and thought into romantic relationships and our family relationships, but friends, those should just happen. And we know that's not actually the case. So with that, after getting some quick scenarios from students talking about overcoming some of their challenges, users are actually presented a lot of different options for actually going out, again, into the real virtual world right now and being able to connect with people. So you can embrace one of these ideas that are, you know, quick, light, and easy, like embracing how uncomfortable it can be to communicate virtually. So taking that risk to get out there into the real world. And again, we have a student perspective down here as to why that helped them. So if you try it, you can get notifications to remind you to give that a shot. And I'm just going to skip through all this really quickly. You get a dashboard. But the really fun part, and what our research showed, is that in addition to how a social interaction goes, how we process that psychologically is incredibly important. So with that, we built in a reflection tool. So after you go out and try one of these, you can rate how that made you feel. It's kind of fun, nice little graphic, whether it made you feel good and positive and I'm relaxed or happy, all the way over to, you know, it made me feel down or stressed, which is something that can happen in social relationships. And from there, you get recommended some exercises to help you, if it was a positive experience, give yourself a pat on the back and acknowledge the progress that you've made. And I'm just going to do a quick illustration of that. This one's pretty fun. So again, appreciating the little things can make a really big difference. I think we all tend to undermine our accomplishments in one way or another. And then this one's just really fun. I don't know if the sound's going to come through, but it's really fun. When you tap it, you get this really great piñata sound. And what this is doing is helping a user just calm down and say, you know what, I did do a great job. I did take a step in the right direction. And if someone endorses that it made them feel a little bit stressed or uncomfortable, they're provided with something a little bit more the lines of, you know what, setbacks happen, be compassionate with yourself. One great example is you can actually play whack-a-mole, which I'm sure you're all familiar with whack-a-mole, and it draws the parallel between we have really unhelpful thoughts that pop up sort of like whack-a-mole at times. And if we can just take a pause, give ourselves some compassion, we can get back on that horse and harness our progress. So you can also sort of track how you're doing and where you're going in the app, and there's a number of other bells and whistles, but I want to pause there, and I want to just tee up that all of these interventions really tie to what we call an impact pathway. And I'm not going to go too far into the science of that, but if folks are interested in learning about that, I can speak for myself, and I think Danielle, we'd be more than happy to dive into the nuts and bolts of that. But I've been rambling for a while. I'm going to pause there.
That's so great. I mean, what a great tool and resource to have that's promoting mental health and, you know, not being lonely. And there's been so many great questions coming through. I'm going to kind of skip around from some of the ones that have come out. But we are going to start with, let me double check with Samantha Spector. Would you want to come off mute and ask your question for Danielle and Nathaan? And either one of you can answer or tag team it.
Sure. So my question, can I start? Sorry.
Go for it.
Okay. So my question, well, more of like, I just want your guys' like opinion on it. Like for me personally, the digital technology in school has been like drastically affecting my mental health. I've had a breakdown like 3 times and panic attacks, which is something that I've recovered from like years ago, and it's coming back now. And I think it's because I'm waking up in the morning with 25 plus alerts on my phone for 17 different classes I'm taking. And like whenever I talk to adults about it or teachers, it seems like they don't understand, or they do, and they're just kind of like, well, we can't do anything about it. And that's something that's really frustrating for me. And like, I just want to know what I can do, or, you know, like, I just want your guys' opinion on it.
Yeah.
You want to start, Danielle?
I can, and then you can also share. So I first of all, thank you so much for being willing to share your experience, Samantha, and for your question. This is a big issue right now, and I just want to validate that this is happening for so many people. So you are not alone in this. This is happening in my own home. My partner and I have 3 children who are 10, 8, and 5, and one in particular is experiencing extremely heightened anxiety when he wakes up in the morning and sees the list of what he has to do. So I just want to tell you, this is hitting home for me as well. And the challenge is that we know some things about how to support anxiety, and I can give you some suggestions, but you know, this is a whole new world for all of us, for students, for teachers who have not had to teach in this way, for school administrators who are grappling with, should kids learn the same amount that they would have learned otherwise? You know, these kinds of questions, I think society wasn't really prepared to answer. And in some ways, we're still getting at the questions while we're simultaneously assigning things, which just feels overwhelming. So if it's helpful to frame it as we're all learning, and that includes, you know, you on an individual level, but also your teachers and your school administrators, it might help to soften the blow a little bit. it might also help you to have some confidence to reach out and keep reaching out to your teachers and to your school and to your support system about how to get through this. So for example, I wonder if there's an opportunity to have an office hour connection with a teacher or multiple teachers to help troubleshoot ways that you can manage, the list each day, and also whether there might be some assignments you could do off technology or things like that. Teachers are often willing, and I speak, as a clinical psychologist, a parent, but I've also been a professor at a large organization, medical school, where I taught for many years. And oftentimes teachers don't know how to help until people come in and ask us the questions and share their struggles. So I bet teachers would be willing to troubleshoot with you. And if there's a mechanism to give feedback in your school about how things are going, please, like you were today, don't be afraid to share what's going on, what challenges you have, and hopefully there can be some adjustments.
Thank you.
Yeah, and just a real quick tip, first to echo everything that Danielle said, and thank you for sharing. There's no way to get that support if you don't throw it out there, so thank you for that. But I know, speaking also as a individual, a psychologist, a parent, many roles, this is something I've actually been experiencing too, in that I'm going to bed at night with notifications going off. I'm waking up in the morning with more notifications going, and it's incredibly anxiety producing. It feels like my brain is never getting a rest. And because there's no commute time, I'm also not even getting that, not that I love my commute, but in hindsight, 20 minutes in the car listening to music is pretty relaxing. So with that, this is the strategies I've employed, and I did a group with some grad students earlier today, and setting really firm limits of all notifications go off at 7 o'clock. I'm making this up, whatever it might be. And when I wake up in the morning, I don't look at any notifications until I finish breakfast, and I go for a 5-minute walk, whatever it might be. But those notifications will be there whenever you choose to open that back up. And I know that it's hard to not let those thoughts of what's there, let me go see it, let me go check. But on days I do it versus days I don't, I know my stress and anxiety levels, and I know my family also appreciates when I set those healthy boundaries as well.
Yeah, it's a ripple effect either way. For sure. For sure. Sarah Dunwoody, you had a great question too that kind of correlated with that. Do you want to come off mute and ask that? Oh, Sarah, I think you're breaking up a little bit. Oh, Sarah, we're having a hard time hearing you. Oh, she's frozen.
Sorry.
It's no worries. I'll just read what you had. Sarah asked if we think schools should be taking steps to encourage healthy technology use for their students, especially right now. Did you guys hear that from me?
I heard you, Emily. Do you want to go ahead, Nathaan?
Sure, I'm happy to jump in. I do really think that this is an important topic. And one thing that I'm really excited about as a clinician, again, a parent and individual, is I feel like the topic of overall wellness is really finally getting more put in the spotlight. That was a terrible sentence, but I think you know what I'm saying. When I started working for that nonprofit, when I asked a lot of schools and organizations how many say that retention is part of your mission, everyone raises their hand. And then I would go down the list and I was asked, well, how many folks have well-being or mental health in your strategic initiative? And literally no one would raise their hand 5 years ago. And over the years, as I continue to present, I'm seeing more and more hands rising, which I am just so happy for and thankful, both as a clinician, but as a person and a parent. And I do think that technology does have to be a piece of that, because technology is pervasive in all of our lives, and we're not taught ever how to use it healthily or not so healthily. Danielle, I'll let you follow up on that.
Yeah, no, I think that is exactly what I would say. I'm lucky enough to be in a part of the country that I think really tends to prioritize mental health in many ways. We're seeing it everywhere from the college level, where there are wellness directors at many university campuses now. And again, that position didn't exist 5 years ago, like Nathaan said. In high schools, that's happening also. But the resources around, there tends to be a lot of technology, social media can be damaging and harmful, but there aren't quite as many practical tips for how it can be supportive. So, you know, out of this whole COVID-19 epidemic, there might be some really promising strategies that we can keep up with in how to be supportive of each other, how to be hopeful about the world, and how to spread love through social media. I don't mean to sound hokey. I know it sounds a little hokey, but it's like some of the most positive things I'm seeing are coming out of social media right now. So maybe keeping that up and not having it be as overwhelming, while simultaneously being really purposeful about limiting technology and social media consumption also.
Mm-hmm.
I'm curious to see how the school environments are when we go back in the fall. For example, if they have more mental health resources, more wellness directors being hired on, because I know I'm here in the Midwest in Indiana, and we're catching up to like what you all are doing on the West Coast, but it's been a slow process to get us there. You know, Ellie, you had a really great question. Do you want to come off mute and ask our friends your question? Ellie? If not, I will read it for you. I just lost it though. Scroll back up here. It's really good. Okay, Ellie Atkins asked, is loneliness considered a mental health issue by itself, or is it something that impacts our mental health?
Either one of us can answer that, Nathaan.
Yeah, go ahead, Danielle.
Okay, so loneliness is not a diagnosable condition. It's not in the book that we use to make mental health diagnoses. It's in some ways part of the way we think about clinical depression, but it alone isn't something that we can diagnose. In fact, when we measure loneliness, we tend to measure it on a scale of how not lonely to very lonely folks feel. So it's not even a thing like you're either lonely or not. And most of the research has not thought about it that way. So it tends to be the second thing you articulated, which is it's a precursor to and really strongly related to a lot of mental health conditions, things like depression, anxiety, thoughts about harming oneself. And, you know, it's frankly so widely experienced, like the Surgeon General highlighted, it's an epidemic. So if we diagnosed people with feeling lonely a good amount of the time, it would be so many people, it wouldn't be abnormal. It sounds strange for me to say, but truly we're thinking of it as a feeling that is so directly related to many of the mental health conditions we diagnose that we want, in order to prevent them, we have to address it.
Yeah. One thing to add on that front, diagnoses have their limitations, and in the clinical world, I think there's people who either like diagnoses or don't. So whole nother conversation, but for someone who's experiencing loneliness, because it's not in the DSM, that doesn't mean that that's not making you feel terrible and that you can't benefit from reaching out for support from a therapist. So I think that's really important to remember, that you know, if something, whether it's loneliness or something similar, whether there's a name for it or not in our diagnostic manual, make sure you're getting the support that you need, because there's help out there for, you know, everything across the board.
Absolutely, that's great advice. Mia, you had a really great question about mental health and research and technology for college and after. You want to come off mute and ask that?
Hi, yeah, so my question was, what is kind of the path for getting into the mental health research and technology kind of side of mental health that you guys are in? Because I really admire your work and I like that kind of side of it, but I feel like it's kind of, that pathway is less talked about and it doesn't have as like strict of like a pathway to get into those fields.
Nathaan, you want to jump in first?
Sure, I'm happy to start. And Danielle might have a lot to add to this, but I can speak to my trajectory. As you can tell, it was a little bit twisty and twirly, which is what got me there. And to be honest, for myself, what really got me here was saying yes to some opportunities that sounded really interesting. I didn't get my doctorate in clinical psychology to work in tech. I thought I was going to be in private practice. And I think it was really, you know, taking an opportunity to consult on a large project and then saying, huh, that's really interesting. Let me look at this nonprofit, which brought me to some scalable work. But all that I do say that while you are in grad school, if you should pursue this, asking questions about grad programs that do offer experiences like this, trying to find an internship at an organization like Grit Digital Health or Hopelab. There's a lot of things that are in place that were not there when myself and Danielle were finding our way. I'll stop there. Danielle, all yours.
So I was going to laugh. That reminded me of how different the world was when I was getting into the field. Social media didn't exist when I was thinking about becoming a psychologist. So Mia, there's kind of two strategies into thinking about digital mental health. There's the mental health strategy, which is, you know, the pathway of pursuing a mental health degree and maybe doing research in psychology or clinical psychology or understanding mental health or becoming a therapist. And then from that, going on to the tech side. And then there's the other lens, which is becoming an expert in some aspect of technology that then leads you to, let's say, work at a company that's taking on a mental health challenge. And I've seen and worked with folks who have gone from both angles. So you don't have to know that you want to do both from the outset to be successful and land in digital mental health tech. So I'll leave it there because I know we've got only a very limited amount of time. And Emily, I do want to give you a chance to ask a couple other questions, but I also do just want to highlight that I threw in the chat a couple of ways that folks can help us with and get access to the Nod app, because I want to really spend the time answering your questions. But in case people are interested in downloading and trying Nod, it is freely available on Apple and Google Play stores, and we'd love for you to write us a review, try it, use it, share Hopelab's posts on social media, and then there may be some opportunities for you to give us some feedback directly on Nod and source the next version of Nod that we'll give you more information about in an email from Bringing Change to Mind after this call. So thank you for that. I just wanted to get it out so that
thank you. Well, that leads me into my last question from Suhan. Suhan, do you want to come on and ask your question?
Sure. Which question? Oh, I had a lot.
About improving mental health based on the data from their app.
Oh yeah. So you all mentioned that like loneliness is correlated to a lot of the mental health problems we've seen today. But are there any other like particularly interesting correlations you find either on like things that improve mental health or make it worse based on the data in your app?
Do you mean interesting correlations between totally different things or interesting correlations between loneliness and other things other than mental health symptoms like depression or anxiety?
Either one.
Yeah. Well, I'd be happy to just speak to that quickly because as Nathaan mentioned, we think a lot about evaluating all the tools we make at Hopelab, and I led a clinical trial. My daughter heard that I was in a big call and she really wanted to come in and say hi to everybody. So while I'm answering the question, this is Luna, she's 5. We led a clinical trial to evaluate whether Nod did indeed affect loneliness, and we found that it did for the folks who were most lonely and depressed who came into our trial. That was a trial with first-year college students. But in addition to mental health symptoms, loneliness is correlated with almost every health behavior under the sun. A big one we found in our study was sleep. So the people who use Nod and benefited from it, so those who became less lonely, also had improved sleep over a month of using Nod. So, you know, we know there's a strong relationship between loneliness and sleep. I don't have time to go into the details of that, but the point is like lonely people, being chronically lonely impacts all aspects of our physical and mental health. So sleep was one that was particularly cool in the study and that we're delving into, but there are others as well.
Thank you.
Sure.
That's great. That's great. So gang, like they mentioned, you can look in the chat to download the app. We will be sending out an evaluation right after the call. And if you want to be part of a focus group and learn a little bit more about helping our friends at Hopelab and Grit make their NOD app even more accessible and applicable to what you all are doing, you'll have that option to do that in the evaluation. So before we take off here, you know, can we let them know where they can all find you, learn a little bit more about you on social media or what Hopelab is doing?
Yeah, I can mention Hopelab real quick. So hopelab.org is the website where you can find out all information about the projects that Hopelab is working on. We're also working on queer teen mental health, teen vaping, young parents, working in a few other really interesting areas. You can follow Hopelab on social, Instagram I've got there in the chat. I tend to be on Twitter, LinkedIn. I'm at Danielle Ramo. And yeah, that's it. I'd love to hear from folks if you have other questions or if you can use extra support right now. I can maybe help to give some suggestions around where to find it.
Yeah. And I'm at doc_Demers on social. And you can also find all at Grit Digital Health tags. And we also have another platform called U at College, which has a whole nother wealth of resources that you can check out. uatcollege.com has all the handles and everything you could want if you're interested.
Wonderful. Thank you so much for sharing your time with us. Can we give them a silent applause? Woo. Before we take off, 2 little housekeeping items. We want to take a picture. So, because if we don't take a picture, it didn't happen, right? So Brenna, if you want to count us down, we'll probably take about 4 pictures since we have about 4 pages. And then I'll turn it over to you, Brenna, to announce our gift card winners as well.
Okay, page 1. I know you guys don't know what page you're on, but everyone smile. 3, 2, 1. Awesome. Page 2. 3, 2, 1. I love hands in the air. I think that makes for cute photos. 3, 2, 1. Okay, last page. 3, 2, 1. Awesome. Thanks, everyone. And I have the wonderful honor of bestowing the lucky gift cards that we are so thankful to Hopelab and Grit Digital for supplying to some of our club members. So, drum roll. Our 20th registration person was Jocelyn Caban from the Michael J. Petra School in New York. Woo, 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 woo. So if you want to wave and say hello. I don't know where you are, but great. Oh, there you are. Hi. Awesome. The next one is Anushka from Dublin here in the East Bay. Saw you somewhere, Anushka. Woo, woo. And then Jody Chen from Monta Vista down in the South Bay. Woo, woo, woo. Okay, I can't see anybody. I know you're on here. And then lastly, we have Ashwarya from Cupertino High School. So congrats to you 4. Thanks so much for being here on the call. I have your emails, so I will reach out to you afterwards so we can get these wonderful prizes to you. Thanks so much.
Wonderful. And thank you all so much for these wonderful questions. I feel like every week we're just blown away by these really insightful questions you have. We will get these to our special guests to see if we can maybe loop them back in to answer some of these all for you. Make sure you are a registered member. That way you get your email to see who next week's guest will be, and you'll be able to register and reserve your spot. I think they'll go fast. And also make sure if you have some quarantine tips you'd like to submit for our Instagram series. We are starting a new IG Live series. We just started it this week with some students interviewing each other. So tune in for that on Monday. And make sure you fill out that evaluation we're sending out right after this call today. So Danielle and Nathaan, thank you both so much. This is such an insightful conversation, so timely. So appreciate your time.
Thank you for having us. Had a great time. Great meeting you all. And don't hesitate to reach out. I'm sorry if you were talking, Danielle, too. I couldn't hear.
It was wonderful to see everyone, and thank you for your great questions. We'll try to answer as many as we can after this.
Great. We'll save the chat and send that over to you all. So thank you all so much. Have a great rest of your evening. We'll see you next week.
Take
Bye.
care.
Bye.
Bye. Goodbye. Goodbye.
Bye.
Goodbye. Where's Pam? Oh, right. Where's Leanne? Like the energy, Marjess.
You're like, bye, bye. Get off.
Because I got dressed up for our call tonight. I got my PJ pants on.
Yes.
I mean, mine never come off.
I matched it with my blanket at least. I thought that was very chic of me.
Very chic. What I'm thinking, guys, is I might just create a new.
Yeah, let's do that.
Yeah. Okay. Bye.